This year, the Manitoba government delivered important updates to support healthcare training in the Westman area. On July 16, 2025, it announced an expansion of physician training seats in Brandon with a focus on rural placements through the Prairie Mountain Health region. The government's goal is to train local residents as they are more likely to remain and practice in rural Manitoba. Additionally, on November 19, 2025, the Manitoba government announced major steps to strengthen emergency medical services across the province by expanding paramedic training opportunities at Red River College, Polytechnic. 14 new training seats were created under this new stream, increasing primary care paramedic enrollment at RRC Polytechnic to 40 seats. These initiatives represent significant steps toward addressing current gaps in Manitoba's healthcare system, particularly in rural communities such as Neepawa. In response, the town of Neepawa organized an information session with the Red River College Polytechnic team on November 26, 2025, to discuss how healthcare workers in the area can access available training opportunities, especially in preparation for the new hospital scheduled to open in 2027.
So it's great to be here, and we brought a good chunk of the team here today for this announcement and to spend a bit of time. We're actually having our cabinet meeting in Brandon today. So it's important that we govern for the whole province, and as part of that, our government decision making for the current time period is going to be made out of the hub here in the Westman region. And if you look behind me, we pretty much have quorum coming out for this announcement because people are so excited. What we're here to announce today is something really special for rural medicine and rural healthcare. Today we're announcing 10 more training seats for doctors right here in Brandon, Manitoba. So when these additional seats come online, that'll mean that there's 20 future doctors training here in Brandon. And this is part of a series of investments that you're going to hear from my colleagues and again some of our other great partners on this initiative that are really about building a pathway into the medical field for kids from rural Manitoba, for kids from the Westman region. Because what we're announcing here today are the capital investments at the hospital, the operating funding to train these 10 additional next generation doctors, but we're also acknowledging investments here at Brandon University to complement and construct a new generation of their science programs here so that we can ensure that a kid growing up in Boissevain, a kid growing up in Sioux Valley, a kid growing up here in Brandon proper has a pathway to become a physician. Speaking on a personal level, my wife is a doctor. She comes from Vogar, Manitoba in the Interlake. After she did her medical training, she did her residency on the other side of the Narrows in St. Rose du Lac, and then she set up her practice in Dauphin, Manitoba. Now, I always joke I owe Dauphin a doctor because I recruited her away from that community. But the point is this: people from rural Manitoba are the most likely to stay and practice in rural Manitoba long term. And so these investments in Brandon and in the region are the best way that we will be able, over the long term, to invest in rural healthcare. It's a major priority. Every time I talk to people in rural Manitoba, they ask about healthcare and what we're doing. Of course, you see a lot of the media coverage on some of the signature investments like the new Victoria emergency room that we're building inside Winnipeg. But don't let that fool you. What is the first emergency room that our government reopened? Carberry. You look at the investments that we made, the first minor injury clinic, basically an urgent care type facility. Where did it go? Brandon, right? And of the 2,500 net new healthcare workers that we've hired, hundreds and hundreds of those folks are working in rural Manitoba, including here in the Prairie Mountain region. So don't get me wrong, plenty more work to do. There's a lot of work to do till we can say that we fixed healthcare. But the good news is we're on the way, and having a pathway for a kid to go from K to 12 to Brandon University to medical school and then to go back to practice in their hometown is part of the vision for how we're going to fix healthcare. Miigwech, merci, thank you very much.
Good morning, everyone. My name is Carla Compton. I'm the MLA for Tuxedo, and I'm also a registered nurse. Before we begin, I'd like to honor the sacredness and importance of this land and of the ancestors that once walked where we are standing today. The Anishinaabe, the Inanawak, the Dene, the Dakota, the Inuit, the Anishinaabe Nations, and the Red River Métis, all who paved the way for what is now known as Manitoba, home to all treaty people. And the reason we share this information with you is that it's a reminder of our treaty histories and the original homelands of all those nations, which have become home to all of us here today. And I would just add too that as a healthcare provider and to these fresh minds that are learning and entering into our healthcare system, it is so important that we remember and we know our history because we want to be the best healthcare providers possible. So welcome and thank you for being here. Today's announcement highlights the next steps in rebuilding our healthcare system by expanding and accelerating paramedic training. This includes new opportunities at Red River College and important progress for advanced care paramedics in rural Manitoba. You'll hear more about these initiatives from our speakers shortly. So to begin our program, please join me in welcoming the Premier of Manitoba, the Honourable Wab Kinew.
Thanks, Charles. Morning, everybody. Thanks for joining us. Today is all about adding more paramedics here in Manitoba. Today, we're really happy to announce that we are launching a new direct entry program here at RRC Polytech. But most importantly, look around this room. Look at all these great paramedics in training. I just want to say congratulations. Thank you so much for choosing a career, a calling, to help our communities here in Manitoba. And on behalf of your provincial government, please stay in the province for many, many years to come. Making sure that there's more paramedics is about responding to the needs of seniors in the community, of folks in our families when we have those unexpected emergencies, but it's also about having a good quality of life. When we want people in Winnipeg, people in rural Manitoba to be able to put roots down here and to call this place home, to build up that bright future that we all want, part of that means having the health care there for you when you need it. And that's what these paramedics in training are going to be doing. And direct entry, to me, it's just such an exciting opportunity that somebody can go straight from high school, that somebody, wherever they're at in life, whatever they're coming out of, is going to be able to step up, put up their hand and say, I want to be a paramedic. I want to be one of the helpers in our community. And that our education system, led by leadership, like here at RRC Polytech, is going to say, great, let's talk about how we make that happen. As part of this announcement today, we're also committing to expanded training seats at the University College of the North, because we know that rural and northern healthcare and paramedic needs are really, really important. And this is one of the crucial ways where we will cut down on EMS response times for folks living outside of the perimeter. So there's been a ton of great healthcare news this week. We're going to be ending mandatory overtime. We're bringing in a patient safety charter. We're going to be legislating staff-to-patient ratios in particular priority aspects of the healthcare system. But so many times the first person that somebody interacts with on their journey of healthcare, it's with the paramedic. And so we want to treat you all right, and we want to say more than anything, thank you for stepping up to help our province. Miigwech, merci, thank you very much.
So thank you, Premier, for those remarks and for your commitment to rebuilding our healthcare system. And it's now my pleasure to invite Rebecca Clifton, speaking today on behalf of the Paramedics Association.
I don't think I can echo Wab's comments anymore. It is it is so refreshing to see an entire room filled with paramedics that might be at the beginning stages of their education, the middle, and you're going to continue learning all the way through your career as a paramedic. And the Paramedic Association is pleased to see more primary care direct entry opportunities available to Manitobans. Just a short 17 years ago, I graduated from small town rural Manitoba High School with no idea of what I wanted to be when I grew up. Paramedics weren't at the forefront of everybody's minds. We didn't have groups like Shared Health, like the government, like Red River going around promoting the paramedic profession. We were always just a little bit hidden and not really the more popular first responder. And so I tried a couple of university courses and absolutely hated it. And then I walked right into the paramedic program at Red River College when it was brand new at the time. That decision changed my life, but it also opened the door to a career that was not only meaningful and challenging, and I could get into it with a path forward, but it paid well, and it's truly a rewarding career. A lot has changed in 17 years. We've had some ups and downs, but the paramedics coming into the workforce today are incredibly well-educated practitioners. The government has worked hard in these last 2 years to break down these barriers to entry. We know Manitoba needs more paramedics, that's not a secret, and we couldn't be happier to see full classes across this province and all hands on deck to make that happen. This will allow students, just like me, to start planning what they're going to be taking in high school, the courses they're going to take to allow them to step directly into paramedicine without delays. It strengthens our profession by attracting young, talented individuals earlier, allowing them to become leaders in the profession, educators, critical thinkers, and skilled clinicians. They have an opportunity to advance in this profession, to make this a career that's going to last a lifetime. Thanks to this government, we are finally seeing real-life advanced care paramedics practicing on ambulances in rural Manitoba, and this is something we personally have advocated for decades, and I don't think I can emphasize how much of a historic moment this truly is. There is more opportunity now more than ever. All of these changes ensure that the next generation of paramedics are ready to serve their communities, to serve and care for Manitobans with skill, compassion, and purpose. And I know that every single paramedic who is out there working right now cannot wait to welcome every single one of these graduates with open arms into the profession, into the ambulance, and into the career. So thank you.
Thank you, Rebecca, for your remarks and for your work and what you and your members do every day. Next, I'd like to welcome Fred Meyer, President and CEO of RRC Polytech, to speak.
Anin Bushu Tanze. Good morning, everyone. Thank you for being here and making the time. Welcome to RRC Polytech's Interdisciplinary Health and Community Services Center, one of the newest spaces at our Notre Dame campus. I want to welcome Premier Canoe for joining us today and making the announcement today. And we are extremely proud to be in partnership with the province of Manitoba to make this happen as well. I want to welcome Minister Azaguara and Minister Cable here as well. Thank you for joining us. Just a little bit on those two departments. We work very closely with those two departments on making changes to our programs to meet the needs of Manitobans. I also want to welcome Carla. Thank you for starting us off in the right way with a land acknowledgement as well. And thank you, Rebecca, for those comments to really hit home. To hear about somebody's own personal journey is always something that is impactful for us here at RC Polytech, but also for the students who are in the room here today. So as I was reflecting on what I wanted to say today, it's exactly 1 year ago yesterday that we opened the doors to the interdisciplinary center that you're standing in today. I also want to recognize and thank the students that are here today from year 1 and year 2 of primary care paramedicine program. I had an interesting interaction on my way in from the parking lot today. One of the students that's here today, we bumped into each other and had a quick chat about what was happening today, and I was talking about the exciting announcement, and they were only focused on one thing, which was the quiz that happened right before we walked in here. So we know they're focused on the right things, which is their learning journey. So great to see everybody here as well. The students that are joining us here today and the spaces that they're learning in represent the future of healthcare and Manitoba's healthcare workforce. One that we continue to build stronger together because RRC Polytech graduates are equipped not only with the knowledge and the skills they gain from training in modern facilities, with opportunities for interdisciplinary collaboration and experiential learning, but equally important is the cultural diverse knowledge and understanding of delivering safe and inclusive, patient-centered care in our communities. One of the largest trainers of healthcare professionals in the province, we play a pivotal role in ensuring that students are gaining the skills, the competencies, and the confidence they need to make an impact in our communities. And we are incredibly proud of the work we do here, and we know it makes a difference in the lives of Manitobans every day. We're also committed to ensuring that we can support even more students who want to pursue careers in healthcare. It's why we continue to work with our partners in government and community to look at ways we can remove barriers to accessing training opportunities. Whether it's updating the entry process for students directly from high school into programs like the Medical Radiological Technology program or the Primary Care Paramedicine program like we did this fall. Or delivering more training in community through our regional campuses or our mobile training labs. This approach to delivering education in community creates new, effective pathways for learners to build meaningful careers without having to leave their homes and their support networks. For example, the healthcare aid training program that is currently being offered in Roseau River Anishinaabe First Nation, or expanding programs like our Pathway to Health program for Indigenous learners. Pathways are preparatory and exploratory programs that help ensure students have the skills and the support they need to confidently transition into specific RRC Polytech health programs. They also provide Indigenous learners with opportunities for reserved seats in healthcare programs like the primary care, paramedicine, or nursing programs. And one of the things about the Pathway program is that it started with a cohort of 24 students, but because of the strong demand, we tripled that program, and now there are 72 seats, and the program is completely full. Our greatest strength is the agility and ability to be responsive and put forth innovative solutions to help address Manitoba's greatest training needs and in healthcare and beyond. And it takes great courage and resilience and compassion to pursue a career in healthcare. I want to thank all the students who are here today with us and who were called to this career path to care for others. Thank you so much. We continue to work alongside our partners in industry and government to anticipate what is needed, not only today, but tomorrow, and to ensure more students have access to training opportunities and supports here at RRC Polytech, so when they enter the workforce, they can do so with the confidence, knowing they have had a solid foundation of skills behind them and they're ready to make an immediate difference. Thank you so much for being here today. Miigwech.
Thank you, Mr. Meyer, for your remarks and your continued leadership. So that concludes our formal program for today. I want to thank all of our speakers and everyone who has joined us. And so we'll now open the floor for questions from the media.
I guess what are we announcing today? This is 14 new seats?
Yeah. You want to jump in here?
Sure.
Yeah.
What's the announcement?
Sure. So we've got a new direct entry pathway that is officially launched. We've got actually, I believe, 18 direct entry pathway learners here today. You want to shout those folks out. Thanks for choosing that. And just, announcing that we're adding capacity. We've added new seats, we've added a new pathway, and we're going to continue to add capacity, including in the north, UCN, and in Thompson.
How many UCN?
We've got 32 seats, UCN and the PAW, 16 and 16.
Right. Can you describe what direct entry exactly means? question, but just.
Sure, maybe I'd ask my colleague to speak to that.
Sure. Direct entry means that the curricula has been augmented a little bit so that courses like anatomy and physiology are included in the curricula rather than having folks need to go to university or to another learning institution in advance with those credentials. So it really allows people to find their way in faster. Actively working in a number of other programs as well to do similar or same things to make the transition easier and put fewer barriers up for students.
And then the 14 seats that we're announcing today and the 16 that are at UCN, are those net new seats? These are new seats at both facilities that have never existed before?
Correct.
Okay.
For the ones in the north, is this brand new? Like, I guess what were the non-direct entry seats that were at these institutions, or are we starting out?
Should know.
So there are, as folks know, there are unique challenges in the north on a host of fronts, and one of the things that we recognized very early that was that we need to break down as many barriers as possible for entry. So the program in the north is direct entry only.
Okay. Now, for the one here at Red River, there are some, the program existed before, there was not direct entry, so are we going to gradually change those to all direct entry?
That's the plan. Yes. So we have people in process already that did not kind of take the fast road. But now everybody will have the same opportunity to enter and continue on their studies with that direct entry.
And in terms of advanced care paramedics and rural ambulances, I know that's been talked about for a while. Where are we at today on that?
We're hiring advanced care paramedics in rural Manitoba for the first time in years. So we've got seats for the first time ever. Thank you, ever. Yeah. And I want to highlight something that Rebecca said, which is really important. Folks have been advocating for that for many, many years. Many years. And, it's something that our government knew coming into office that we needed to take action on very, very quickly. We've got a number of advanced care paramedics now working in rural Manitoba, and we look forward, the Premier and I and Minister Cable, we get a letter of offer in the hands of folks before they graduate. We look forward to making sure that these learners who want to pursue advanced care paramedicine jobs have those letters in their hands before they graduate, and they know exactly where they're going to be working before they get through their studies if they choose to.
So yeah, everybody heard that? We're hiring everybody. We're hiring everybody. If you don't get the letter, come see us.
Yeah.
Are there any advanced care paramedics in rural ambulances today?
Yes.
You know,
We can get you that number.
And then maybe this is something we need to follow up on as well, but just wondering, do you know how many net new paramedics have been added to Manitoba since October 2023?
We can get you that number. We've got a number of folks. Obviously, we've now got ACPs working in rural Manitoba. We've got PCPs. We've done work to make sure that we've got emergency medical responders. We've got much more emergency medical response capacity now in rural Manitoba than we've had in many, many, many years, in some cases ever with ACPs. But we know there's much more work to do. We're in a room today with a full class of paramedicine students. It's been a long time since we've had that happen here in Manitoba. We've got seats in the north. We have more capacity to train people now than we've ever had, and there's more work we have to do. So we want to make sure, yes, this is a big moment, this is a big day, but we want for all of these folks in the room to be pumped about the jobs that they're going to be able to practice and have in Manitoba, and start telling their friends so that we have more folks who join the front lines and join this program across the province.
Is there a financial component that's going to Red River for this? Like, does Red River get any additional funding to open these seats, or how is the province kind of navigating that?
I'll probably have Minister Cable speak to that in a bit more detail. We've got a really strong partnership with Red River College. I have to say they have been incredibly responsive, a phenomenal partner to work with. And of course, post-secondary education is Minister Cable's responsibility, and they work with Red River to make sure they have the adequate resources to deliver these programs. But we work across departments in government. So we identify in health, what do we need in our healthcare system? How much more capacity do we need? Where do we need that capacity to be? And then we work directly with Minister Cable and Red River and our partners to make that happen on the post-secondary level. Do you want to speak to dollars, or?
We can.
Yeah, sure.
So every program comes with a proposal from the post-secondary as to what it is going to cost to deliver a full cohort, and that is the funding allocated for it. We are in the process of doing our estimates for the next year. We can follow up with specific dollars for today, but that will continue to evolve with our continued conversations about the need for expansion on different programs.
We have over 3,500 net new healthcare workers in Manitoba. We have over 1,200 net new nurses working in Manitoba, and we are hiring nurses every single day in this province. We are training more nurses and more healthcare workers than we ever have in our province's history right now in Manitoba. And that is something for us to be really proud of. We also know there's more work for us to do, including on the nursing front. So we're going to continue to hire. We do not want to lose any momentum. We want to continue to add as many nurses as possible to the front lines of our healthcare system. We recognize as a government that ending mandatory overtime, particularly as a staffing tool, needs to happen. And so we are going to be holding regional health authorities accountable to that. We're going to be working with them to ensure that they're taking a better approach. We've got the nurses in the healthcare system to do this, and we're going to keep hiring as many nurses as possible, including welcoming nurses from other jurisdictions to our province, from the United States, internationally educated nurses. There are many folks now who are looking at Manitoba as their top choice, not a flyover province, because our government is taking these steps.
Do you personally believe we have enough nurses to end mandatory?
Yes, and this is an important step for us to take. We've heard from nurses for many years that they want to see this action taken. It's a step that our government needs to take, and we're going to continue to hire as many nurses as we possibly can and welcome nurses to our province so that we can end the practice of mandatory overtime. I'm a nurse myself. I worked on the front lines for years. I know the impacts of working mandatory overtime. The Premier has said it previously. We've said it really well, I think, already. Manitobans should trust that when they're showing up to access health care, that they're getting the care from a nurse who hasn't been mandated to work back-to-back, in some cases to back shifts. And nurses deserve to know that they can go to work, have a good work-life balance, and go back home to their families and have the quality of life with their work that they've been asking for. So it's an important step that we're taking. We're going to keep hiring nurses to make sure that we move in the right direction.
There's research that I believe is Canada-wide that says 57% of nurses leave the profession after 2 years. I imagine the numbers aren't necessarily great in Manitoba either. What steps are you taking to?
Oh, we've taken a number of steps. We know that the data that was released recently on that in terms of nurses leaving the workforce and young nurses, that was data that was actually gathered under the previous government, right? So under the previous PC administration, yeah, we saw a lot of nurses leaving the workforce. We weren't hiring net new healthcare workers or nurses in Manitoba. We are hiring net new nurses to the front lines of our province, and that's really important. Ways we've been able to see that change happen, making sure that we're collectively bargaining agreements. You know, all the paramedics in the room here today have a collectively, paramedic students, you'll be paramedics soon enough, have a collectively bargained agreement in place so they can have good paying jobs with benefits, incentives in place. For almost 6 years, paramedics in this province didn't have an agreement. Their wages were frozen, which was totally unacceptable. And we saw a loss of 90 paramedics in rural Manitoba as a result. So as a government, making sure that we are treating workers, healthcare workers fairly, making sure they have bargained agreements, making sure that they've got a better work-life balance, making sure that they have respect in the workplace, adding folks to the front lines, making sure that we're listening and showing up to their workplaces as we've been doing as a government and will continue to do, to not only hear their concerns, but to action their solutions. So all of the steps that we've been taking, we're seeing that pay off with net new nurses being in our healthcare system. But again, there's no end date to this. There's no finish line. This work has to continue. We're going to continue to make workplaces safer and more secure for nurses and paramedics and healthcare workers across the board so that we can continue to see that trend of net new healthcare workers across our province.
Back on paramedics, the union says there's been a net gain of just one paramedic so far in 2025. If we are graduating dozens each year, what's going on?
Look at the room that we're in right now. We've got a full class for the first time in a long time here in Manitoba. The work to turn around the damage done to healthcare, including losing almost 100 paramedics alone in rural Manitoba, doesn't get fixed overnight. It takes time, it takes teamwork, it takes sustained effort, and that's what you see. You see partnerships across this province, government, Red River, Paramedics Association, shared health, organizations that are working together to make sure that paramedics have what they deserve to have in work-life balance, in agreements, in incentives, in packages and support in communities and mentorship so they can be successful when they work those jobs across the province. So we are moving in the right direction, but it takes time to fix the magnitude of damage that was done. And as the Premier said, we can't thank these folks enough for choosing this calling. Working in healthcare is a calling. It's an incredibly rewarding profession. It takes special people to choose that path. And I'm absolutely thrilled that we've got a room full of paramedicine learners who are going to be working across Manitoba, including many of which in this room in rural Manitoba, sooner than later.
Maybe just switching gears here, just a quick one for Premier Canoe.
Great job. That was awesome.
Can you let us know when can we expect to hear updates about the plans for the safe consumption site? When will the location be released?
So just a note on language. We say supervised consumption site. And the reason why we say supervised consumption site is we want to be realistic about what's happening in this facility. And we also just want to make it clear that we're talking about a healthcare service here. Supervision, meaning a nurse or a nurse practitioner or somebody else with some great training like the people that we're here in the room with today who can talk to somebody about maybe making that change towards recovery. Or get tested for pregnancy so that we can stop syphilis and HIV being passed on to babies as they're born in Manitoba, or even just getting a primary care appointment so that somebody's lingering healthcare issue can get addressed. Maybe we're not going to get somebody to turn their life around 180 degrees overnight, but maybe we could start to put them on a more positive path by tying them into primary healthcare. That's what we mean when we say supervised. Just to say a supervised consumption site is going to be about tying somebody in to healthcare. You know, in terms of our legwork on this, we are pretty much ready to go. We've got to do a process with the federal government to get approval because it is a serious step that we're talking about here. We anticipate January, and you know, that application will be submitted like in the coming days or weeks, and you'll see the details there when it gets submitted. Yeah.
And then in terms of those community consultations and notifying folks so they can be part of those, when will that take place, and how does the government
within the same time period. I mean, we've done a ton of consultation about this already. I think it's no secret. You guys do a great job of helping us get the word out every time there's some news on supervised consumption. And so we'll have those next steps of community consultation, the submission to the federal government, you know, location, all of that in the coming weeks. Yeah, between now and the end of the year.
Okay.
Yeah.
Are you leery at all because of the pushback that happened at the Point Douglas location? I wonder if there's some reluctance to say where this is going to be concretely, you know, just given what happened last time when the community pushed back.
Drive down Main Street. Tell me, what do you see? That's the alternative to having a supervised consumption site. It's not like, do you agree with a supervised consumption site like out in some like utopia there? No, like the alternative to a supervised consumption site is unsupervised consumption site on Main Street, in the bus shelter, in the bathroom at Tim Hortons. I think we all agree we got to do better than what we're seeing right now. And so again, we've been flexible and we've been listening. We've changed the location based on community feedback. I think that's an act of good faith. But at the end of the day, the doctors, the experts, the healthcare professionals with an expertise in addictions medicine say, you know, you're doing enforcement, you're doing prevention, you're doing recovery and treatment, but here's one additional harm reduction tool that you can add to the arsenal. And when we're talking about life and death, we're talking about overdoses, we're talking about babies being born with preventable disease. Like a baby in a rich country like Canada should never be born with HIV. That is entirely preventable. Same thing with syphilis. And yet it's happening in our province. And it's a recent phenomena. It only started happening within the past decade, and it's because of IV drug use. So again, I understand that people like hear supervised consumption and they're like, I don't know if that's right. But the thing is, it doesn't happen in a vacuum. You have to understand that the reason Manitoba is about to open a supervised consumption site is because we have babies being born with HIV right now in a way that didn't happen before. We have people who are overdosing in public places or in people's basements at private homes in a way that far outstrips what the numbers were historically. There's been a little bit of an improvement in the trend, but it's still much higher than the historical average. So again, you know, not to put too light of a spin on this concluding comment, but this is why I say it's like Buckley's cough syrup. It tastes awful and it works. Right? So I'm not asking you to like the supervised consumption site. I'm just asking you to understand that this is a public health emergency that we're responding to, and it's one of the tools, not a silver bullet. It's one of the tools that will help.
Thank you.
Yeah, no, thank you.
Climate Action Team Manitoba figures consider the announcement of the power generation facility Brandon would contradict your goals to get us to net zero by 2050. How does the turbine facility fit within that path to net zero? Is this a quick fix?
Is this?
A quick fix.
Well, the net zero is a deep conviction of our government. We want to do right by the climate. We also have this guy to the south of us with the spray tan and you know, all sorts of terrible nicknames for reporters that is trying to damage our economy. Building these turbines is part of Trump-proofing our economy. What have we got to do to insulate Manitoba from the impact of the Trump tariffs? One is we need to put people to work. So we're offering a job to all these paramedics. We're also going to invest in $3 billion worth of construction behind this new energy plant. So all the people in other parts of the campus here who are getting their trades, who are working towards their red seals, this is how we're going to put you to work. And this is in rural Manitoba. This is just outside of Brandon. So this is a big province-wide economic development incentive. And then power. The coldest days of the year, when they come in January, we import power from the U.S. right now. Given what Mr. Trump has done, we can't count on that. We shouldn't rely on that. We have to be independent. We have to be independent when it comes to our money, but we got to be independent when it comes to our power too. And this energy plant will help us do this. At the same time, when you think about the environment, it's going to start with natural gas, but we can convert that to renewable methane. We can convert that to hydrogen in the future. So the idea is let's build up our economy now, and then we're going to use technology to make sure that we hit the goals on the environment, and we'll hit that net zero target by 2035 when it comes to our power grid.
When do you think you make that transition to natural gas?
Yeah, I'd love to do it tomorrow, but the reality is we don't have a hydrogen industry in Manitoba or Canada, so we got to see the business step up there. And then with renewable methane, there is actually a proponent in the Brandon area working on that right now, so that could potentially happen in the 3 to 5 year timeline. So yeah, it's really, really important. When people from the environmental movement raise the concerns, I hear you. But the reality is no one's given up their phones. No one's given up their cars. No one's going to accept a freezing home on the coldest day in January and February. So this is what we're doing to keep the lights on and to keep the furnaces running. And at the same time, absolutely, we'll work with you to make sure we have a safe, clean, healthy environment for the future generations.
And just we're on a different note as well. Alberta has voted the notwithstanding laws to protect gender bills or challenges. What do you make of this news? Also in advance of the Trans Day of Remembrance, which honors trans and gender diverse folks that have done.
Well, you know, our government has always been very, very clear. We stand with trans communities. We stand with trans kids. And we'll continue to do just that. You know, our government's also brought forward legislation addressing the notwithstanding. And I think we've also been very, very clear that protecting human rights is something that is a value of Manitobans that we're going to continue to uphold. So, you know, it's difficult to see trans youth and their families struggling under conditions that, you know, you think we'd be well past by now. But, you know, this week in particular, it's so important for us as a province to celebrate the fact that we're led by a premier and we have a government that stands with trans communities and supports families who are navigating gender diversity as part of their journey. And, you know, I had the privilege to sit down with a doctor from the United States who was relocated to Manitoba in the last 3 weeks. This is a trans physician who loves our province, who is thrilled to be providing care to Manitobans, and is grateful to have a place that they can call home, know that they're safe and respected by their now government. And so, Manitoba, I think, has an opportunity. We as a government have the opportunity to continue to be led in a good way. The Premier sets a phenomenal example for the rest of the country in terms of how we stand with communities who deserve to have their human rights protected. So in this week in particular, I think it's really important for Manitobans to continue to be focused on being unified, standing up for human rights, and celebrating what makes us strong as a province, and that is our diversity, and that includes our gender diversity.
And the bill that your government introduced around that notwithstanding clause, can we anticipate that comes shortly, either you or the Premier?
I definitely defer to the Premier on
It'll
that.
be reintroduced. Yeah.
Got one question on Zoom.
Queued up.
We'll go to Zoom now.
Thank you, Minister. We have one outlet on Zoom today, Brandon Sun. Tessa, one question, one follow-up. Go ahead.
Thank you so much. I have a question for Rebecca Clifton. Rebecca, you said that Manitoba needs more paramedics, and that's no secret. And I'm just wondering, can you describe that need as it relates to the Brandon and Westman area, please?
So I think this government has been very transparent with the number of vacancies that exist. They've been very collaborative, talking with a variety of municipalities and elected representatives out there, as well as the communities. We know that the minister was just out in that entire area within those facilities talking to those groups. There is a substantial vacancy rate within that, what we call the Western Zone of Shared Health ERS. And I know that the collaboration between government, the educational facilities, as well as Shared Health, they are working together to try and determine where those hard-to-fill areas are and how do they get people to fall in love with those communities. Is it accommodations? Is it incentives? How do they support everyone? I think there's a variety of different ideas that are being discussed. Where do we start people to then maybe go to some of the harder-to-fill locations? It's been an ongoing conversation. Those vacancies kind of continue to exist and continue to climb, but we also see vacancies that exist within the city of Winnipeg. So we know that through the collective bargaining process, as the minister mentioned, paramedics are seeing really great wages and really great benefits to working outside of the city of Winnipeg, which is then allowing them to enjoy the profession, to do that work, fall in love with those communities and the care that they're able to provide Manitobans. And I think all of this room full of paramedics, if we had a time machine, we would use it, but we don't. And so those vacancies are extensive. We are looking at numerous vacancies in the province, but with a little more time, eventually all of these bright-eyed paramedics will be out there supporting the existing paramedics who are working very hard to maintain the services in all parts of rural Manitoba, but particularly in that west zone of Manitoba.
Thank you. And I just have one follow-up question. How many more paramedics are needed in the Brandon and Westman area?
I would like to say every single paramedic learner in this room, you're welcome. You're welcome to the Westman. We could use each and every one of them. We can get you an exact number on that, Tessa, but to Rebecca's point, we're working directly with municipalities. We're working with community health action committees. We're working with Shared Health, with RRC. We're making sure that we are taking a pretty targeted approach so that we know exactly where paramedics are most needed, and we're getting those opportunities right in the hands of folks as early as possible. So we can get you some more specific details offline, but I can tell you, I was just in the Westman, had a great conversation with community out that way, and we're working together to find some really creative ways to make sure that we're building up capacity as quickly as we can.
Thank you, Minister. That's everything from Zoom. Back to the room.
Alors, juste pour finir en français, nous sommes très, très contents puis très fiers d'accueillir tous les étudiants ici et c'est une prochaine étape pour promouvoir le système de santé dans Manitoba. Merci beaucoup.
Thanks, everybody. Thanks, folks.
All right. Stay to the side. Hi, everyone. Thank you so much for being here. We've had a great time in Neepawa already. We spent the day here, and we were introduced to the Bolas, and it was amazing. And tonight we're going to the Brew Brothers, because we hear it's a great place to go, and so far our experience in Neepawa has been amazing. Thanks for the warm hospitality. So Marilyn, thank you for inviting us today to share about our programs. I'm here with Agiram Kasimova, and she's the project coordinator for the health courses that we're going to talk to you about. And Heidi DeFair over there is the language pathway support specialist, which is a very long-winded way to say that she meets with each and every internationally educated health professional that comes through our doors to ensure that they are choosing the right classes and that they have an understanding of a licensure pathway when they have questions. She makes referrals to nurse navigators and other navigators for physicians and allied health, etc. Our specialty really has been internationally educated nurses, and we're just really happy to present today our courses. So thanks for having us. And Agiram will start with.
But you have to introduce yourself first. Who are you?
Oh, who am I? I'm Debbie Craker, and I'm the chair of Occupation-Specific Language Learning for Professional Advancement in Healthcare, which means that all of our language and communicative competence courses are my portfolio. And so we network with different partners and collaborators in Manitoba to make sure that IENs and IEHPs have the services they need, the language skills to keep everyone safe. And now we'll do the language.
Now we'll be doing environment management. Red River College Polytech campuses are located on the lands of Anishinaabe, Ininewa, Anishinaabe, Dakota Oyate, and the Nesubinu, in the national homeland of the Red River Métis. We recognize and honor Treaty 3 territory of Shoal Lake 40 First Nation, the source of Winnipeg's clean drinking water. In addition, we acknowledge treaty territories which provide us with access to electricity we use in both our personal and professional lives. At REC Polytech Center for Newcomer Integration, we are deeply grateful to live and work on these lands. Our training programs reflect this respect by integrating Indigenous knowledge and promoting cultural safety in healthcare settings. We are proud to support internationally educated health professionals as they transition their skills and expertise to the Canadian healthcare system. Through occupation-specific language training and career-focused programs, we empower newcomers to build confidence, achieve licensure, and thrive in their chosen professions. The key part of this journey is learning to communicate with cultural humility and respect for all patients, including Indigenous patients and their families.
All right, so we just wanted to get an idea of who's in the room so that we're speaking to the right audience. And I think that I have a bit of a feel for that already. How many of you are employers? Okay. How many of you are in settlement workers in Neepawa? Okay, and how many of you are IEHPs or internationally educated health professionals? Okay, okay, that's great. And how many of you are healthcare aides? Okay, did I miss anyone?
Remember the employment office.
And the employment office,
Employment.
settlement and employment. Okay, thank you. That's great, thank you. Okay, so we are going to get started with Heidi.
So hello everyone, can you all hear me okay? Okay. Great. So today this is just a quick agenda of our presentation this evening. We'll introduce you to the CNI, talk about funding and who actually pays for the courses. We'll give you an idea of the sorts of courses that we offer, as well as webinars and workshops. Talk a little bit about the registration process and how you actually go about taking a course with us. And at the end, we will have a question and answer time. So if you can hold your questions till the end,
please feel free to write them down. Maybe we'll answer them in the meantime. That would be great. Thank you. The Center for Newcomer Integration is a language school within Red River College. It's funded, our courses for health are funded by IRCC and also by the provincial government of Manitoba. The CNI by itself does offer general language training, or the LINK program, but we also have occupation-specific programs. And like Debbie said, our portfolio is health, so that's what we're here to talk about today. Our courses are funded by the government, so that means that for the students, there is no charge. Currently, we have funding for all immigration statuses: permanent residents, Canadian citizens, refugees, and work and study permit holders. Really, the only people right now who are not eligible for our classes would be someone on a tourist visa. So that is a really nice special funding arrangement that we presently have. Often when we think of language barriers, we think just about vocabulary or grammar or basic speech, but we have come to realize, and you all probably know as well, that the real challenge in healthcare settings is communication and also that intercultural competence piece, right? People know the language, that's the tool they use to form the sentences, but really communication is how we use that language tool. And even if someone's comfortable, right, with everyday language, working in healthcare, you're covering sensitive topics, communication can be nuanced, and so it's really a different level of language and communication than is required for basic function, for basic life. It's really awkward to be working with patients and not be able to say exactly what you want to say, right? Not to be able to convey the tone that you want and just really connect with the patient. Also, communication with the team, the healthcare team is really important. Both the verbal communication, giving report, writing your notes, all that really comes into play. And so we focus on our program in communicative competence. We're not teaching the skills to be a healthcare aide. We're not teaching the skills to be a nurse. We're really focusing on the language piece.
In other words, we're staying in our lane. Communication.
So here's just a list of some of the courses we offer. You don't have to memorize the list. It just is showing some giving you an idea of what we offer. So communication for professional practice for IENs. We have communication specifically for IENs, and then you can see the third one, the workplace communication for people already working as healthcare aides or support workers. We have a communication for health professions. I'll talk about that a little bit more. We have a nice pronunciation for health professions and some additional intercultural communication sorts of courses. Our courses are designed to be flexible. They're all online, okay? Live online courses with an instructor and classmates. And most of our classes offer a day and evening attendance option, where when you register for the class, you don't have to register for the day or the evening, but you come each day as suits your schedule that day. We've done that because most of our students are working shift work and rotating shifts and can't always, They can't
always attend based on their
shift, right? Commit to the same course. So we try to make it flexible.
I don't mean to interrupt you, but we also record it so that the last resort really is that there is a recording available if they couldn't make it to either. So.
Okay. Once
students are registered in our courses, they're also invited to optional workshops and seminars. You can see them up there. So our workshops, the standardized patient workshops, give you an opportunity to practice your interview and patient communication skills. We have an actor who comes in, and you sign up for a small group workshop, and you take turns interviewing the patient, eliciting a health history, that sort of thing, and then you get feedback at the end. So that's a nice small group. We have guest speaker webinars on relevant topics like dementia, Indigenous health, and we offer some workshops to help IENs specifically prepare for a CELBAN exam. Again, these are just optional. They're one-off kinds of things where if you want to, you sign up for the 3-hour session or the 4-hour session if you have time that day. And those are not things that students can get invited to unless they're registered for another class at the same time. We offer a course called Communication for Professional Practice for IENs, and this is a neat course. It is a 4-credit course that will count towards RN or LPN bridging. So this course can already be taken before you get referred to bridging by CRNM or CLPNM. And if you successfully complete it, once you get to bridging, you've already taken this communication course. It's not a language course. It doesn't meet the English language requirement. You still have to pass a language test, but it's the communication course that IENs will need to take in bridging. And just to give you an idea, this course will meet again from January 6th to March 19th, Tuesdays and Thursdays. This course only meets from 9 to 11:30 a.m. online. Okay, next slide. Pronunciation for Health Professions is a really popular course. You do not have to have a background in healthcare to take this course, but you should be planning to pursue a career in healthcare. This is one that's a little bit longer. You can see it goes from January until the end of April, Mondays and Wednesdays. And there are those 2 times that I was talking about. So every Monday you have to come to either the 10:30 or the 4:30 class. And again, on Wednesday, you choose one of those classes. So it's a twice-a-week class. Some other courses to highlight. Communication for Health Professions. That is a 1-semester full-time program, and successful completion of that course meets the English language requirement for someone who wants to study nursing from the beginning at Red River College. It also meets the ELR for some of our allied health programs. That does require a CLB 7. So most of our courses, well actually all of them, have a minimum CLB language level that we do look at. Some of those are a bit flexible, but when I meet with students, I look at what their CLB levels are, and then we can decide what courses they're eligible for. The second one there, workplace communication for healthcare aides or support workers, like I said, for people already in that field. If somebody, this is not for someone who wants to become a healthcare aide, that's a different program, right? But this is the communication if you're already working there. It's only once a week, CLB 5+. And then the communication workshop series just talks, it's again, workshops that we offer, communicating with patients and families, with coworkers, and communication skills. Our courses, upon completion, depending on the course, they will give a certificate or a transcript or the credit if they're 4 credit. But it's just this slide is just to let you know that the different courses, depending on the course, will give you different certificates of completion. If students, I mean, it's a lot of information, right? And
the course that you might take depends on your background, depends on your goals, depends on what you did work as or are working as or what you want to do in the future. So I do meet with everyone online in like a Teams meeting, or I can do a phone call as well. They can always reach out to me if they're unsure, right? And I'm happy to advise. And of course, if we don't have something for them, I'm happy to try to make referrals. If you're not a good fit for our program, we can look at what else you might do. I do a lot of pathway advising with people as well, making sure that they're, if it's an IEN, making sure that they know that there's funding available and have you applied here and applied here. And the same for, I can help physicians or pharmacists or other IEHPs as well. So how to attend our courses. Because our courses are funded by the government, everyone does need a current WellArc assessment and referral. So WellArc, for people that live not in Winnipeg, they can do online assessments. You don't have to go into the city. If you have a WellArc assessment that's less than 2 years old, WellArc can use those scores. You don't have to have a new assessment, but you do need to be referred to us. If a non-permanent resident, a non-IRCC person tries to go to WellArc, WellArc probably will not assess them. So if someone is interested in our program specifically, they should let WellArc know that they want to be referred to RRC CNI MSSS program. That's the code. That's how WellArc knows to send you to us. So, and it can also help you get sometimes seen a little bit sooner. So if someone wants to be considered for our program, they should start with a WellArc assessment referral, and then that would come to me, and then once we see what their WellArc scores are, we can go from there. Unfortunately, we cannot use a CELPIP exam or an IELTS result. It does have to come from WellArc. And here's to schedule an appointment. You can see there some ways to schedule with WellArc. And lastly, Agira or Debbie, can you think of anything that I missed before we start the question and answer?
Well, if people forget that special little code, do you know what it is? Can you remember? CNI, MSSS. Yeah. But in the event that they just say, I want a health program at Red River College, WellArc knows to send them to us. It's expedited. They don't wait in the queue like people do at WellArc. They do get expedited to us. So they can just say health language training.
At Red River.
That'll work too. Yeah. At Red River.
Yeah. Yeah.
So are there any questions?
Are all the courses that you're offering the twice a day, are they available to people who you're not from Winnipeg, because you're through Teams or?
They're all online.
It's all online.
We have no in-person classes because our classes are for anyone resident of Manitoba.
Nice.
Yeah.
And how often then? So as per terms, how often are they on?
Yeah, we are in a term cycle. Fall and winter, we offer most of those classes. Spring, the schedules are different, and we maybe only offer 1 or 2 because it's a condensed term, right? So I always suggest, if you're interested, contact me. If we don't have what you're looking for right now, then I keep wait lists for the upcoming semester. And so when someone goes on my wait list, I would like this class, the next time it's offered, then I'll email them the next time it's offered and say, these are the times and the dates. Are you interested? So just because you're on a wait list, you're not committed. It just means you will receive information about the further course offerings.
So is the WellArc more of a screening
Exactly.
class as opposed to the CLB, which is not?
Well, the WellArc will do a speaking, they'll do an assessment, listening, speaking, reading, and writing, give you a CLB in each area. They'll also check your documents. They'll verify, your documents and ask you some questions of how long you've been in Canada, that sort of thing, just questions that the funder wants to know for statistical purposes. But yeah, it's like I guess they're the gatekeeper essentially. That's not a question really, but it's just a resource for everyone as well. We do well-work assessments at the settlement office. We have someone that proctors the assessment for them, so if they are having trouble doing the well-work themselves, they can come to the office and we'll assist them with it.
That's great.
Yes, and we can then use that as well. We've had that before. You know, if you already have CLB levels from another settlement place, often Weller can use them.
Like the Weller is still done by the people from Winnipeg.
Yeah.
It's just like we kind of help them through the process as they're doing their assessment.
What a great service. That's fantastic.
It's good to know.
Any other questions? There was a lot of information about our courses, and they're all similarly named because they're about communication, but they are offered to different levels and for different purposes, as you saw. So we basically, they meet with Heidi and she figures out what their goals are with them and then navigates what they take and helps with the pathway.
Yeah, and depending on what's happening, I mean, our courses change. We look at demand and what people want. So we often will have new courses or maybe we don't offer a course. You know what I didn't mention is really important. We have a course, maybe go back to the CIEN slide. Where is, maybe it's
CPP for ENs?
No, I think it's number 9.
Yeah.
So this course, the second one, CIEN, that course is unique. When students take that one semester course, at the end, they receive 4 CLB levels. IENs, to get funded for the pathway in Manitoba, need CLB 777 or higher to be eligible for funding. If they come in lower than that, they can take this class, CIEN. They'll get their certificate of the scores that they earned upon completion of the class. And if they get 4 7s or higher, the Manitoba IENs program, the funder for the pathway, can accept a certificate from that course to determine that they've met the eligibility language-wise for funding. It's not a language test. CRNM doesn't accept it for licensure, but the Manitoba IENs program will take that. So that's a key course for many of our IENs who need to get their language up a little bit higher to qualify for funding, for pathway funding.
That was one of those things that just sort of happened.
Yeah.
That they started to see the scores coming out of our class, and that's what ended up being, the path to releasing funds. So it's been really interesting.
Yeah, so certain of our courses are really key. That would be that one, and then the other one is CPP IENs that can be used for the bridging credit. Yeah, are really applicable, practical courses.
This is launching in January this is the first offering of this particular course, but it's a spin-off on another course that we deliver, Red River College delivers for AC, for Assiniboine College, consistently over the years in the bridging program for LPNs. So we basically took that course with with the regulatory body approval, CRNM's approval as well, and we made it into a course that can be used for either one. Assiniboine College continues to provide the LPN specific components that were incorporated into that course. So that's all covered off. But there was so much similarity between the two courses that both regulatory bodies agreed it should be one. And that really helps us with funding, because then we can just offer that course 3 times a year and we can fill the seats, and that allows us to continue to receive funding for it. So, yeah. And it's nice if you can have the advanced credit when you're going into, let's say, an NREP program, if you're an RN, or an internationally educated nurse that wants to be an RN, because it's a really intensive program. And I guess the same thing with PNQR. So it just saves you a little bit of time once you're in that program. Anything else?
You talked about meeting with people, and so obviously we're a rural area, so you meet with people over the phone or through virtual calls too?
It's either, it's a Teams meeting, but if they want to request a phone call instead, then they just let me know. I prefer a phone call.
Okay. They don't have to come meet you?
No, no.
everything we do can be done virtually. If they want to come in person, that's great too. The standardized patients workshop, which has been a booming success to get that clinical type practice for communication skills. It's been amazing because we have this state-of-the-art sim center at Red River College, and so we're using that. We're bringing the actor there. And so that's one where we say in person is way better, but we have delivered it online to ensure that we're meeting people across Manitoba. So the actor is just not quite as realistic, but it is still very engaging, and they're getting the same customized feedback on their performance when they do it online. So yeah, we can offer it both ways. We do offer it both ways to accommodate. That's probably our biggest goal, is to make sure that this is available to everyone, regardless of their location and their schedule. We're pretty accommodating. Any other questions or comments that we can help with? All right. Well, I just want to say thank you. Yeah, is there a question here?
Did you have a question?
Okay. Yeah, well, thank you so much for taking the time to be here today. And if you have any more questions, we actually have posters. If you're an employer and you want to put up a poster, feel free to take some. I have extras there. We've got postcards, so if the employment and settlement offices, we've already given you some if you feel like you need more, just for students to, potential clients to take, that's fine too. And for the IENs here in the crowd, please reach out to Heidi if you want to have a conversation about next steps or any courses that would work for you. So, yeah.
Thank you, everyone.
Thanks again, Marilyn, for setting this up.